When we talk about the flu, we're talking about a series of infections caused by an influenza virus. Every year there are several viruses that float across the world, and every year we give vaccines against those viruses. Last year, particularly last spring, we had a new virus called H1N1, or the new influenza virus. It caused a lot of panic because a lot of people hadn't been exposed to this virus in the past, and we don't have a vaccine against it.
H1N1 tends to affect younger people and actually young healthy adults more than we are seeing typically with seasonal flu every year. So it has a different epidemiology, as we would say. It tends to be, in terms of severity, very similar to seasonal flu, but it is that different population, younger people and previously healthy people, pregnant women. It seems to have a higher severity than what we see with regular seasonal. It's thought that because the younger people have probably never been exposed to this strain of virus, that is why we're seeing it. This emerged from probably from different origins, perhaps bird origin as well as swine origin, and that's where it got its name. But it has components of both those animal viruses as well as human virus. So it's a new strain of virus that is circulating, and that's why it is affecting so many people. Most of us have not been exposed to this before.
I think right now, and Dr. Price as well as many of the public health officials are working very closely, is that we get the correct information out to people. Because I think we want to have people appropriately prepared with good information how to protect yourself, as well as what you can do if you are sick, and we'll talk about that. Because I think that's an important message to get out there, is that there are things you can do to prevent from getting sick, and if you are sick, what you should do.
They're very similar. Both H1N1 and seasonal influenza present very similarly. Both have fever as an important symptom. Often people have cough, sometimes sore throat, sometimes severe muscle aches and pains, headache. And when you're experiencing those symptoms, if you are sick, having trouble getting oxygen, having trouble breathing, you should come see your doctor or come to the emergency room. But if you if you aren't severely ill, then you should stay home and take care of yourself. Go to bed, get plenty of rest, drink lots of fluids.
The biggest thing that from a community standpoint that we're trying to encourage people to do is that if you're sick, you stay at home. And we're encouraging people to wash their hands frequently, particularly after they sneeze or cough. That's very important. And if they do sneeze or cough, they should sneeze or cough into their sleeve or into a disposable tissue and then throw that tissue away. And then wash your hands frequently, whether or not it's with soap or water, 15 to 20 seconds, or with an alcohol-based gel.
You need to get a specific H1N1 vaccination. The vaccination for seasonal flu is only effective against that virus. It's still very important that you get the seasonal flu virus. Virus vaccine. We have to remember that influenza, regular influenza, kills up to 36,000 people every year, and this is an important push that we do every year to try to get our public vaccinated and increase the awareness of the importance of preventing regular seasonal influenza. But when H1N1 vaccine becomes available, we will first focus on the priority groups designated by the CDC who are most at risk for severe complications or even death from H1N1. Those groups will be offered the vaccine first, and then as we have more vaccine available, we can expand that to other people as the supply allows.